had a baby in mid-October, and so I've been helped by the Poole health visiting team. So I have generally had a really good experience with them, in particular because we've been back into lockdown since I've had the baby. They have been really helpful and gone above and beyond in some situations to look after me and give me extra care and keep in regular contact with me to make sure that I'm getting on okay. Myself, I've suffered with a bit of postnatal anxiety, and also we've had some feeding problems with my baby. He's suffered with both reflux and colic. Where I have been a bit anxious, I've needed a bit of extra support. I've been really lucky that although the team haven't been able to necessarily come to the house, they have kept in regular contact with me, more so than they would do normally. So I was receiving phone calls every week or so from them to check in with how I was getting on and check how I was getting on with baby's feeding. When I was trying to raise some of the issues with my GP and wasn't necessarily getting the support that I would have hoped for, the health visiting team were kind enough to offer to speak to the GP themselves for me as well if I needed a bit of extra support in speaking to them. Now, I'm a health professional myself. I'm not a nurse, but I am a health professional, so I would normally be pretty confident in speaking to the doctors about needs and about worries. So therefore, for me to feel like I needed a bit of extra help with that, I think just shows that actually the help that I was offered would be really important for other women as well. So I found that sort of suggestions that were made were things that I wouldn't have thought about as a first-time mum. There were products that I don't know about, and they sort of help to suggest those things to me. So a particular thickening agent that can go in normal formulas, and each time I tried something, they would try and contact me and check how it was going until the final time where it's all been now going well, and so that's great. It was ways of feeding that I wouldn't have necessarily thought about, how to do things, and I found that they were very attentive in making sure that I was okay with that, and also, as I say, with supporting me with the GP if we had got to the point where I needed to push for some lactose-free formula or hypoallergenic formula. They would have supported me in that if we'd needed to go down that route. In the end, we've sorted him out with some comfort formula, which again I didn't really understand fully what that was, but they helped me to understand how that would potentially help him, and also that with Carabel, the thickening agent, how to use that to help him as well to stop his reflux. My health visitor would call me, and she would then, each time she spoke to me, she would sort of say, do you feel like if I was to phone you in a week's time or 10 days time, how would you feel about that, or would you like me to call again sooner? And so that's how we did it, and then she would ring me on that day without fail, really. Every now and again I might not answer, there'd be a bit of back and forth, but that's not their fault. And also, you know, I knew I could contact her in between as well if I needed to. Yes, I could have done. Yeah, she did say I could text her if I wanted to. I don't think I actually did in the end. It was always, I was able just to happily speak to her when she rang me. There was once in between where I did contact them, sort of in between the phone calls, and they were very quick to get back to me, which was great. I wasn't offered any video calls at all. It was all done via phone calls. But as I say, that was nice and regular. But at times, I think it would have helped. It's sort of you know, things like when I was feeding Freddie, sometimes he'd be coming up with rashes and things, which we weren't quite sure whether potentially he had a bit of a milk allergy and things like that. To be able to actually show them those things probably would have been quite helpful, and I would have been confident to do that as well, as I'd had a few consultants appointments via video during my pregnancy. So with regards to having the baby weighed, I did have the first few visits to the house as normal, where they would weigh and measure the baby. But however, because of the lockdown restrictions, the usual clinics where you might be able to go into a children's centre or something like that to have baby weighed and measured in between the normal visits aren't happening. I understand, you know, it's difficult with the restrictions. However, as somebody who was quite anxious with her baby having some feeding problems, I found that I would quite like to have been able to do that if I needed to. But what I do think might have helped is with the video, the ability to have a video call is to be able to weigh and measure the baby up in with somebody watching. That might have been quite helpful to then know that I'm doing it right. The other thing is in this household we do understand growth charts, so we know how to plot them, we know how to sort of understand them. Again, you know, if we can understand that and do it, but still be a little bit worried as to whether we're doing it right or not, somebody else without that knowledge really might be quite anxious about it. So I did find that some of the information, sort of contact information and information about groups that would normally run in the area obviously isn't quite accurate at the moment in the information that you're given, and also information about how you're going to have various checkups being done. That's not necessarily accurate for what's going on with COVID lockdowns and stuff now. Obviously when I had my baby it was mid-October, so it's been happening for a little while and things have been shut down or not been happening as normal for a little while. So I do think maybe just needs to be looked at, the information that's being given to new mums, and just advising them what will actually happen, what they should really be expecting. One of my friends, she had her baby a lot earlier in the year, so she had her baby mid-February last year, and she found that where she did have the first couple of visits from the health visiting team, it then completely stopped during that first major lockdown, and there was no contact at all really, apart from a little bit here and there where she contacted them. She, I think, would have found, obviously I'm speaking for her a little bit here, but I think she would have found just a bit of information to say, actually, we are in lockdown, you're not going to hear from us. The reason you're not hearing from us is because we think you're doing okay, but please feel free to contact us if you need to. This is normal for this situation. I think that might have helped her to worry about it a bit less. Pam is my main one, and then Sarah Hoyle also visited for a while because Pam was isolating. And as I say, Pam, even though she was working from home, she was always really on it with calling me when we'd agreed to speak and things. So.